and welcome to Ask the TA, a periodic segment on HCAT where viewers can send questions for the town administrator and other town representatives to answer for the benefit of all Holliston stakeholders. I'll read the question for discussion today and then introduce my guest. The question from a viewer is, how has the town made progress with recommendations from Municipal Resources Incorporated, or MRI, for the organizational evolution to the Holliston Fire Department, specifically in relation to the ambulance service model? To answer that question today, I have Chief Cassidy with me. Chief Cassidy oversees the fire department, which includes the ambulance or EMS service, and is also the emergency management director for the town. Chief and I will review the progress made on the MRI recommendations and preview the next significant change, which we'll be asking for town meeting support on May 15th, 2023, namely the creation of the Assistant Fire Chief EMS Director position. Welcome, Chief. Thank you for being here.
Thanks for having me.
Let's get right into it. We have a lot to cover. And so I'm just going to give really high level, and then we'll get into the details as we move forward. So the town meeting in October of 2021 supported an organizational evaluation that became the MRI report, which was presented to the Select Board in May of 22, so just about a year ago at this point. Staff has given a few progress reports to the Select Board since that point. We'll go through a few of those items as well. And the next major step is going to be on the upcoming May 2023 annual town meeting as it relates to a significant new position, which is the Assistant Fire Chief EMS Director position with paramedic certification within that job description. We'll talk about that in a little bit. And one of the major milestones that was a point that MRI made to the community, which we've made the commitment to, which is trying to achieve ALS licensure from our current BLS licensure. There's some OEMS guidance that goes into that, and also some staffing model changes that we'll be looking for in the coming years. And so with that, let me get into sort of how that looks in terms of the categories of recommendations and what striving for ALS versus BLS means from a fire chief perspective.
Absolutely. So first of all, from a delivery of pre-hospital medical care, there are several levels of licensure and care that's available to our patients. So when someone calls 911 and requests an ambulance, we are staffed and we are licensed at the BLS level, which means that our EMTs can respond in the ambulance. They can deliver care to the BLS level. There are a lot of interventions that they can do. There are several medications that they can administer, and they can treat and transport the patient and bring them to the closest, most appropriate emergency room. There are certain medical conditions, reasons why people call 911, where they need care that's above our BLS licensure. And for that, that is referred to as the ALS license, or Advanced Life Support. And there are two different tiers of advanced life support. There's actually advanced EMT, and then there's paramedic. What we are striving for is to get a full ALS license to be licensed at the paramedic level, and we understand that that does take a couple of years to get from the level that we are at now to the point where we would be able to be licensed by the Office of Emergency Medical Services, which is a part of the Department of Public Health, at the advanced life support level. ALS services include more advanced interventions. So they are more medications that they can administer. There are more procedures that they can perform on a patient. Both the BLS and the ALS services are an extension of the emergency department. We're operating under the authority and under the license of a medical director, and there are state regulations which guide what is a BLS skill versus what's an ALS skill. And as patients are being sent home from hospitals sicker and sicker because of changes to healthcare and how long insurance companies allow you to have an inpatient hospitalization. As our population ages, we see more and more serious medical issues in the community. So over the years, the number of calls where we need ALS intervention has increased. For years, we were primarily providing BLS care, and occasionally we would use ALS intercept services, and that number of ALS intercept services has increased not only in proportion to the increased number of 911 calls for the ambulance in general, but also as people are sicker and as people are in the community longer, we often need more ALS services.
Great. And I think, for people to understand as well of how communities provide these services in different ways, I think one of the questions that I posed to the consultant, not because I was pushing that outcome, but more because I think the town needs to consider all options, was, you can outsource this service, and MRI very specifically and intentionally indicated that they felt that we should be within our model, striving for ALS and keeping the service in-house for a variety of different reasons that they explain in the report, which is available online, and presentations to the Select Board. So right now the goal is not to outsource the ambulance model. It is to, within our current framework and some significant changes that we'll talk about shortly, strive to go from BLS to ALS, which would be approved through OEMS, and we'll talk about that in a second. The Assistant Fire Chief position, I think we'll get into quite a bit in a moment. The facilities, I think obviously anytime we're changing and we have more standby staff in our facilities than we did in a previous model, there's some facility changes that we'll talk about as well. And then dispatch is the last sort of major component of the MRI study that you and I have been involved in for quite a while now, Chief Stone as well, because dispatch is obviously a general public safety function. And so just so people understand, the MRI's recommendation on dispatching was to look at a few different options. One would be to change significantly if we were going to continue to do it as we were, make some significant improvements to technology at significant cost. Another option they presented was to move the fire EMS or EMD dispatch function from Central Fire over to the police station to consolidate. We looked at that as well and the costs associated with that. We have some significant potential costs that would have been on the police side as well from a technology perspective. And ultimately, the decision was made holistically for public safety to move to a regional, it's known as a REC, but it's Holbrook Regional Dispatch. And so we have that plan for a cutover period of January 1st, 2024. So is there anything else on dispatch that people should be aware of or that sort of ties in before we move on?
From an end user perspective, there really will not be any significant change for them. If they call 911, the fact that someone is answering the phone starting in January in Holbrook should not impact the delivery of service at all. They're still going to have the same type of radio console. They'll be able to be in immediate contact with cruisers that are on the road. They'll be able to contact the firefighters and EMTs or paramedics who are on duty and be able to dispatch those. And there's going to be a very seamless transition.
Right, and we've seen this happen with our neighbor Sherburne, who went live January 1st, 2023. All of the sort of technology upgrades that we're looking for when it comes to 2023 public safety dispatching all comes through this process. A number of our actual dispatchers in Holliston will end up most likely working in Holbrook as we go to the transition. So as you mentioned, seamless, but a major component and a significant amount of bandwidth from our public safety officials and administrative staff in addressing not just the MRI report, but what we had already sort of kicked off with our neighboring communities, as dispatching has been an issue in the area with Medway and Millis and others, with a Collins Center study, which sort of dovetailed nicely with where MRI came out on their recommendation. So going into facilities, I do have here at the bottom, dispatching space within Central Fire within that transition becomes part of potential new opportunities for us to use that space to support our fire and EMS operations at the Central Fire Station. We've had some updates to the 5-year capital improvement plan based on the MRI recommendations. And actually recently I shot another Ask the TA with Select Board member John Cronin on what we're looking at for a new DPW facility at 20 Cross Street that could theoretically add a satellite location that might be better based on MRI's recommendations of giving up one of our lease spaces and a variety of other things that could really present some future opportunities for facilities for fire EMS in the future. So I know you've been working diligently on making sure our facilities are being prepared for the changes that we see coming, but is there anything else on facilities that you'd want to mention?
Right, so if one looks at the MRI report and in the area where they're talking about the facilities, there were some concerns with regards to the area where currently the EMTs are doing their documentation when they return from having dropped off a patient at the hospital. Historically, they've been doing some of those reports in the ambulance bay. Certain times of the year, it's either very, very hot or very, very cold. So the expectation is that with improvements to the building after the dispatch function has moved to the REC, then we can repurpose that space as a report writing area. That's very similar to what one sees at hospitals. They actually have a little room off to the side where crews can do their documentation before returning to service. And so that would be our expectation, is that we'd be able to reuse that space, and it's conditioned, it's accessible, and it's not right next to where vehicles are parked, and that's going to be a win-win for everybody. In terms of some of the improvements to the space, facilities has been a great help in terms of making sure that our facility is able to house people around the clock. When the facility was renovated back in 1999-2000, it really wasn't anticipated that there would be round-the-clock occupation, other than perhaps a dispatcher and the chief of department. And so to the point where we are now using what was previously meeting room space and public access areas as dormitories, and we continue to make additional sleeping quarters available. Facilities was great in making sure that a shower facility, which had not been operable since the building opened up in 2000, no one had tried that shower. He was able to get that up and running, so that now if someone works an overnight shift at the station before they head out to their other job or whatever else they have planned, they can take a shower in the private shower room and change into their civilian clothes and head out. So those have all been great improvements. We continue to improve the facilities and make it a little bit more homey, so that folks don't feel like they're staying in a youth hostel.
Yeah, and I think the kitchen as well there. So kitchen, showers, private rooms, but all of which are still undergoing some improvements to make that a more comparable facility for 24/7 in the year 2023. So,
right.
Very good recommendations from MRI. The facilities manager, James Keese, as you mentioned, and yourself have been working diligently on that. And so more changes to come. I think, there's going to be, people need to follow along with the 20 Cross Street process there, but I think that's an absolute opportunity in the future as well. And then so moving into the work plan as it relates to the Assistant Fire Chief EMS Director, this is going to be probably the biggest point going into town meeting. We've gone through a few iterations of this. This was one of the major recommendations from MRI. You've worked with the HR director as it relates to the job description. And additionally, what we'll go through here is very high level on the screen, but much more detailed on paper, which we were providing to stakeholders like the Select Board, Finance Committee, others, to show what you get for the money that we're asking for at town meeting is a work plan that phases an individual in over really 3 years before they're fully baked as an Assistant Fire Chief EMS Director. So if you just want to kind of go through high level here, and we can make sure people are comfortable with that. I know we've disseminated the work plan to those interested, but if this would be an opportunity to kind of sell it as well.
Sure. So for the first year, obviously the primary focus is going to get to know our operations, understand how our ambulance is currently staffed, identify the gaps, fill in some of those gaps, focus on quality assurance, focus on recruitment, and really this is part of the reason that we're at this juncture, is because there is a staffing crisis in EMS. According to a recent American Ambulance Association study, there's been a 39% turnover of part-time EMTs and 55% turnover of part-time paramedics that have gone unfilled. And so the challenge that this new hire is going to face is recruiting and retaining personnel. HR has been great. We've had positions posted for many months. Recently, we've been able to hire a couple per diem EMTs, but the challenge that we face is we've got 42 shifts per week on a 7-day basis to fill, and it seems like just as soon as we get somebody onboarded, we get somebody signed off through our field training program, oftentimes life situations change, they get a different job, they're no longer available, and somebody who had committed to 3 shifts now can't work at all. Somebody who was working 3 shifts has a job change and now can only work 1 shift a week. So getting a handle on our staffing model, understanding people's capacities, and figuring out who from our existing bench strength is interested in going to get trained to be an ALS provider. Some basic life support providers have an interest in advancing, and this initiative, going to ALS, will be an opportunity for them to get that training, and we can support them through budgetary support. But there are other providers who are not interested in being an ALS provider, but can continue to be the best BLS provider provider they can. And part of this person's role, the assistant fire chief, EMS director, will be to figure out people's strengths and really help support those, identify weaknesses, and figure out how those can be supported either through a different partner or through additional training.
Right. And so we're on a fiscal year basis, obviously, so when people see FY24 on the screen, that means theoretically this is approved on May 15th by town meeting. HR is ready to go with a job description. We get somebody in, ideally at the beginning of the fiscal year. So within 6 months, that person is going to be overseeing, under your direction, the renewal of our current licensure, right? Because that's done on a calendar year basis. And so we have a 1-year license right now that runs through the end of calendar year 24. Calendar year 23, which is in the middle of FY24. So that will be in the first 6 months, right? And that's how the work plan is sort of designed, with 3 and 6 months and so on, of things that we see that this position is going to really pick up. And I think people should understand as well the benefit to the whole organization does come into play as it progresses in the future. It really becomes a number 2 in the fire department, which the fire department incorporates EMS. But right now, that is, in many ways, we have the on-call deputies, we have an entire structure underneath you, but this becomes a person full-time who's there to be also supporting all of these operations. The paramedic licensure is part of the job description for this person, which adds that component to our internal capacity as well. Anything for the out years that you want to cover here? I think we have the highlights on the screen, but really it's focusing on EMS, especially in the first year and 6 months, with the licensure up midway through the first fiscal year that this person would be here, and then sort of growing from there.
And it really gives them the opportunity, where that license is up for renewal within the first couple months of them starting, is to, as they work on compliance, as they work on the application for the renewal, and then as they sit down with the inspectors who come from OEMS, they can introduce themselves, because they may not have been involved with an ambulance service license at a previous position. So they can get to know the inspectors, understand what the inspectors will be looking for, and the inspectors can help guide them as much as they're allowed by their agency in the next steps in terms of how to position their role, their work plan, and the way they work out the recruitment plans, and they work out the supply needs and all of the stuff that they need to get a handle on. Meeting with those OMS inspectors early on, not only as part of the renewal of our BLS license in December of 23, but then looking forward to how quickly after that would we be able to put in an application for an ALS license, and whether that was seeking a PB waiver, which would allow us to have ambulances that are staffed by both paramedics and basics early on, or whether that's having a fly car model. There are a whole bunch of different ways for ALS to be delivered in a community, and as you said earlier, each community around us does it a little bit differently. Some use private ambulances, some are municipal fire service ambulances, and we need to find out what fits for our department, what fits for our community, serves our citizens, but also is within the regulations and realistically can be achieved to satisfy the state regulatory requirements.
Right. Very exciting. And I think, just so people understand the fly car, because I think we had it on the screen earlier, so you mentioned the PB and the fly car. If you just kind of show those, but more in the context of those are two things that we'll be considering as we move forward.
Right. So a PB waiver allows, instead of immediately having a license that requires a double paramedic staffing in an ambulance, a PB waiver allows you to have one paramedic with one basic in the back treating the patient. And then if it's an ALS2 call, which requires additional ALS interventions, then you would be recalling an additional paramedic to join the crew, or possibly getting, once again, mutual aid, an intercept from another ALS licensed service. And the fly car model is one where the paramedic is responding in perhaps a shift supervisor's vehicle. If they are needed on the call, they can do the interventions and be on board for the transport. But if it's truly just a basic life support call, then the ambulance crew that's staffed at the basic level can ride that in, and the supervisor who's in the fly car, as it's referred to, who has the ALS licensure, can return to the station and be available for first response for the next call that might come in.
Great. So a lot to consider, and obviously this position is going to be a major component of that with you and HR and myself and the select board and stakeholders as we move forward. So a lot more to come on that, but with that, I think we want to put that in the context of things that have happened so far and then next steps. So the October 22 Fall Town Meeting supported one of the first recommendations from MRI, which was to sort of fix our EMT paramedic rates. That was a significant change that we made that will help recruitment and retention. The regionalization for dispatch that we talked about goes into effect at the end of this year, but has been committed to by the Select Board. The reorganization of the Central Fire Station for increased on-site personnel started already, but is ongoing, as we mentioned. Still challenges to make sure that some of the creature comforts are there to really bring that up to 2023 standards. The creation of the assistant fire chief we just went into at length, and so I would say in terms of next steps for anybody following along, the position has been vetted internally by you, the HR director, recommended for approval in my recommended budget, the select boards and the finance committee. So really the next step is town meeting on May 15th. That position will be part of, with you, the HR director, increased recruitment and retention efforts for EMTs and paramedics. That's going to be a major component of that, and then that will lead into sort of the next licensure conversations, as we talked about, for BLS to ALS in the future, and how quickly we'd be able to sort of have that conversation. So I just recommend to everybody, especially we have a number of residents that are very interested in this topic, following along, really interested in seeing this through, and so I would encourage everybody, even if this is the first time you're hearing about it, to say that May 15th, Holliston High School, auditorium, town meeting, that's the time to show support for this major next step in the process. Is there anything else you'd like to add before we close it?
So in full transparency, it's not just the addition of the position, but also there is a capital component to this. There is a request which has been, as you noted, included in everybody's recommendations thus far, for a vehicle, because in order for this person to have success and be able to respond to these calls and be available, they need to have an equipped vehicle that is from our fleet that is issued for their use by contract. And then just to circle back to one of the big steps that we did take last fall, those changes to the rates were really instrumental. Could not have done that without the implementation of the Programmatic Stabilization Fund, which really allowed the town to be nimble and to be able to really be innovative, which municipalities aren't always known for their ability to be nimble or innovative. Right. And so that fund was absolutely key to helping us raise those rates, which I think has allowed us in recent weeks and months to be able to interview and make job offers to additional per diem EMTs.
Right. That's a great point. And a lot of good things at the town meeting and the budget as well. Additional trainings, all the things that we've talked about in MRI. I think this position is probably what people will see the most. But there are other components as well, as you said. Outfitting a vehicle for an assistant fire chief who is a paramedic is a significant cost, and that is also on there under a separate article for the capital budget. So more to come on this, and obviously any questions that we receive, we'll be looking forward to a positive discussion on town meeting floor. Thank you for being with me.
Thank you for having me.
Okay. And thank you to my guest, Chief Cassidy, and thank you for watching Ask the TA on HCAT. We hope you found it informative. If you have a question that you'd like answered in a future segment, please email us at the address on the screen below. Thank you for watching.